This young lady is such a positive person. She came to see me with her parents and her younger sister, who I'll show in just a moment, who had also severe scoliosis, as did this young lady who's 22 years of age and is a college student and a very supportive older sister to her younger sister. And so as a practicing Jehovah's Witness, as the families are Jehovah's Witnesses, they do not accept blood transfusions. And I've done many surgeries in Jehovah's Witnesses over the years in which we really minimize blood loss. And I think it's not just for Jehovah's Witnesses, but we apply the same techniques in the operating room for every last one of our patients so that we can minimize the amount of bleeding and prevent blood transfusions and potential complications of blood transfusions. This young lady, who's very active and likes to dance and exercise, she had two curves. The one at the bottom is quite large, and then a large one at the top in the thoracic spine, and typically we would have fused both of the curves, but she and her family really pushed me to see if we could just do the lower curve, and so we did just that, and it's really worked out so well. She had very minimal blood loss. She had a 3 or 4 day stay in the hospital and is now beginning to return to full activities at just several months after surgery. So we're very pleased that her correction is quite successful, has been quite successful, and we are going to allow her to do everything, and she really ends up with a very short spinal fusion rather than fusing a much greater extent of her spine.